Hi, I'm Mark Alyn, and along with Dr. Greg Celaya, we're going to explore ways of staying healthy naturally. Our guest is Dr. Greg Celaya. He's a functional medicine specialist. He has advanced degrees in nutrition. He's a doctor of chiropractic and an all around nice guy. Dr. Celaya, what is functional medicine?
Hey, Mark, it's nice to see you. You know, functional medicine is quite a bit different than your regular allopathic medicine. Let me explain to you what it's not.
Okay.
First off, when you go to a doctor, usually they've got 10 minutes allocated to taking care of you. And their solution is to come up with a diagnosis and then treat the problem, and you're on your way. That's the insurance model and the medication model. Well, when was the last time, Mark, that you heard a doctor saying, let's get to the root cause of the problem?
Not often. And what you're talking about are the problems, are the symptoms, maybe uh, constant coughing, constant sneezing, elevated temperature, uh, uh, a um, a rapid pulse that's constant, things like that. Whatever the situation might be, that is not in quotes normal.
Yeah, you're exactly right. What you're usually experiencing is a set of certain conditions that lead to a problem, and they're just treating the symptom. And it's not that they're bad doctors, they're great. They're just in a certain type of model that's different than functional medicine. And with functional medicine, we look at everything from the biochemistry, even down to the cell level. Mark, when was the last time you had a test that look at the biochemistry of the cell? Probably never.
Never.
We no. And we look at the genome, we look at the DNA. So we can have DNA run and take a look to see what type of problems you're predisposed to. We can look at allergies. We look at the immune system and how it's functioning and maybe how it's not. We can look at the nutrition. And nutrition's huge. It's a huge tool to getting people well. We look at toxins. We look at hormones. We look at infections. We look at stress. We even look at your circadian rhythm, how you're sleeping, and the list goes on. But we're looking for the root cause of the problem. And we're just not treating symptoms because treating symptoms doesn't necessarily work.
Well, it's like putting a Band-Aid on a wound. I mean, if it's a deep wound, you need to go to a doctor who can treat that wound. But in the meantime, you want to stop the flow of blood. Would that be a good analogy?
Right. But let's say you have a wound and you go to a doctor and all they do is sew it up, right? They don't clean
Right.
it out. They don't get rid of everything inside. Let's say you fell on the asphalt and they got to scrub out the rocks, right? I don't know if you ever
Right.
had that done before,
Yeah.
but, but it doesn't do you any good. It'll stop the bleeding if you sew it up, but you're going to end up with problems later, like infections or scar tissue or who knows.
Well, in functional medicine, you kind of look at a holistic approach of the body. Is that how that works?
That's exactly it. And I love looking at the biochemistry. So you can see what's going on, right? You also have to study research. In fact, I'm studying research every single day on different conditions, different nutraceuticals, different dietary plans, I mean, it just goes on and on.
Well, I recently spoke to a doctor, uh, a natural doctor, a naturopathist, and he was telling me that there are literally thousands and thousands and thousands of clinical studies that show that supplements, for example, are effective, uh, and that, but for some reason, uh, medicine in general, traditional medicine, discounts that research. Have you found that true as well?
Well, yeah, but you have to understand where they're headed, right? So, natural supplementation or the natural biochemistry agents or nutraceuticals, you're not going to patent them. There's no money in actually looking at a pharmaceutical company working with a supplement. And so, therefore, that's not where they're educated. Most doctors are educated by pharmaceutical companies and they're in an insurance driven model. And the insurance doesn't necessarily pay for longer in depth consultations. It's like, for example, with my first consultation with a patient, it's usually an hour and sometimes even more. I have to look at everything, Mark. I can't just look at an isolated stomach issue because that's just one little part of the puzzle. Your body's health is dependent upon everything. So I'm going to look at brain health. I'm going to look at your immune system. I'm going to look at autoimmunities. I'm going to be looking at just everything, your adrenal glands. I mean, the list goes on. And my questionnaire goes on as well. So when somebody comes,
It's an extensive questionnaire that you have. I
well,
mean,
yeah, I have to. I have to know exactly what's happening with every part of the body because everything's tied together. You can't isolate these things and get down to the root cause of the problem.
with functional medicine, do you think that that will become the forefront of healthcare in the near future? Is it becoming more and more understood and accepted, not by the industry, the healthcare industry, but by individuals?
Well, it's getting more accepted by individuals that want to get to the root cause of their problem and are willing to be accountable to make changes in their lives. So we go back to the pharmaceutical model and the insurance driven model. You know, functional medicine's not for everybody. Sometimes people want a simple, quick, what they think is a solution and usually isn't, by just taking a pill and not having any accountability. And they can go that way. It's just a matter of time. It's like, for example, you see the rates of diabetes are dramatically increasing. And every time you turn around, you look at somebody and there's weight issues and there's diabetics. And I'm seeing them every day in my practice. And they're not even told to do the right things. So I just saw a gentleman with diabetes and his blood sugar was out of control. And he went to see his doctor, and his doctor said, well, here, just take this medication, metformin. He didn't mention anything about nutrition and advanced biochemistry testing. Nothing.
Exercise.
Nothing. No exercise, nothing.
My understanding is that metformin, the longer you're on it, the more your body needs to maintain that same level too.
Well, it could be, but it's with this gentleman, we looked at everything from A to Z, and I started really simply by just changing his diet. And in a day or two, we continued to do sugar testing. And his sugar testing went from well over 200 to
Wow.
below 90 in a couple of days.
Just by
So,
watching what he was eating,
absolutely. Yeah.
which is that's obviously that's a major significant change to him. In looking at diabetes as an example, we have an epidemic, and I just heard today that Mexico is right behind us. In fact, they may be ahead of us in this with obesity. They drink more sugared drinks apparently than any other country in the world. They're cheap, they're somewhat thirst quenching, and at the same time, you shouldn't be drinking them every day, if at all. My point is that can we eat what we want if we exercise and watch other areas, or is it we are what we eat?
Yeah, no, it's, going back to Mexico, and I spent some time in Mexico. And the reason, at least for us, coming from the States, when we go over there, you're not drinking the water. And really, the only thing that is safe are the sodas. So it may be the same for them over there, but it's more having to do with commercialized systems, right? There's money in it. And where there's money in it, there's going to be companies that manufacture foods, and those foods may make it so you want more, you'll drink more, and therefore you end up with more problems. But
I'm sorry, we are talking with Dr. Greg Celaya. He's a functional medicine specialist. You can find him at drcelaya.com, drcelaya.com. And if you have questions, he'll be more than happy to answer them. There's a little tab there, and you can send him an email, and he'll be more than happy to talk to you. And of course, he's available for consultation, I guess, anywhere in the world. I think you have to speak English. That's it, right? You're fluent in Spanish.
Yeah, I speak Spanish and, maybe a little bit of German, but there are great translating systems as well, or even somebody to help. So,
Oh, okay.
we do
Got it.
see people from all over, and it works great.
Uh, the eating clean is something that you and I have discussed on late night health in the past. Is that the key to the main key to proper health, to good health?
Well, it's one of them. It's so important to eat as clean as you possibly can, and maybe one day we should talk about what eating clean is on your
Right.
show. But it's dramatically important. And, we've come to a point where we expect everything quick and fast and prepared for us. And that's where we get into trouble. It's not what our bodies are used to. It's what the commercial system we should, says that we should be eating, but it's really not what we should be eating.
Well, we live in what I call a soundbite society. And, our news stories are 2 minutes, interviews are 3 minutes. In fact, many news stories are shorter than 2 minutes. We just want a taste, if you will, of a news story, and then they move on to something else. And I think our food system is the same way. We want quick, fast, easy, and possibly even cheap.
Well, yeah, I mean, the media really controls what you're consuming, whether it be commercials, whether it be internet-based ads, whether it be what is in the grocery store or the store you're shopping in, right? That dictates to what you're going to buy.
Functional medicine, as we said, takes a look at the whole body. We have a thing at Late Night Health Radio, and I'm giving myself a plug here, latenighthealth.com. And Dr. Greg Celaya is, of course, a regular contributor to Late Night Health. My question is and I lost myself here. Um, functional medicine takes a look at the whole body, mind, body, spirit, is what I was going to say, or does it? Is the spirit um, an important aspect to maintaining good health?
I think it is. It's something that your choice and what you want to believe, but you definitely have an inner spirit that you have to nourish. And it's like, for example, if you're just sitting down working 24/7 and you don't do the things that you need to do to keep yourself in tune, like maybe it's play golf or go riding bicycles or whatever it may be, your health will suffer. It's all part of the picture. Everything plays a part in your health. And unfortunately, the medical community tends to isolate things. So, for example, let's say you have an allergy. Well, you go to the allergist and all they look at is allergies. Or you have an immune system problem. Well, all they look at is an immune system problem. And it's not that simple. It's not like you can isolate things, and you can't isolate your spirit and how to nourish your spirit as well. It's part of the whole program.
And those who are depressed, who have a lot of stress in their lives, those are the kinds of things that can also affect the mind, the body, and eventually the spirit.
Well, and it goes both ways. But you have to remember, depression's not just a disease, it's a set of conditions that lead to depression.
Explain that.
Well, there's so many things that can contribute to depression. There's biochemistry issues, there's blood sugar issues, there's adrenal issues, there's thyroid issues, there's lack of exercise, lack of activity. We could keep going, but it may not be that simple just to say, hey, you've got a dopamine problem.
Right. And it's also, I guess, some other issues in there could be stress at work, stress, money, stress at home, worrying about your kids, worrying about your future. All of these things do count.
Absolutely, they count. It's all part of it. And we have to remember that. And like I said, you can't isolate it out. That's why my questionnaire for a new patient is so extensive. And it's why I go in depth in detail and look at everything, even though they may have a certain condition. Let's say they're having headaches. Well, it's just not a headache problem. It's a whole body problem that may be the root cause, and the headaches are the symptom.
And how about we've talked about that it's an extensive questionnaire. How long is it? How many questions?
You know, I haven't counted. I just redid my questionnaire and it's online now, which is great. In the past, I had a written form that I used to send people, and it was close to 20 pages.
Oh my. It could be it could be 200 questions. And
Easily 200 questions.
Dr. Celaya, thanks for joining us. And we look I look forward to talking with you again next week. We'll do another, talk and figure out how to keep people happy and healthy.
That's great. Thank you, Mark. I appreciate it. This was a lot of fun.